Thank you for the opportunity to come and talk to you about erectile dysfunction. It's a topic that traditionally Kiwi men aren't particularly comfortable with, and it's been put on the program today to get us more comfortable to illuminate the topic. That's why I've got the little picture of the light bulb to put it on the agenda so we can have a chat about it. Sexual function for men is actually a really important issue. It's important for self-esteem. It's also important for sexual intimacy with our partners and wives. I deal a lot with paraplegics, and it's interesting talking to them. There have been a number of studies done with paraplegics and tetraplegics, and if they were given the opportunity to be able to walk again or to have normal sexual function, they often choose normal sexual function, which is really interesting. So the topics for today's talk, we're going to define what erectile dysfunction is, talk about how common it is, what might cause it, and then we're going to talk about what we can do about it. So what is erectile dysfunction? Well, it's the inability to consistently attain and maintain an erection that's satisfactory for sexual intercourse. When I get people coming and see me, people don't always know what erectile dysfunction is, and they may come with one of these other issues, which might be a low sex drive, or also called a low libido, or it may be that they have an ejaculation problem. They ejaculate early, or they're not able to ejaculate, or they're not able to achieve an orgasm. But erectile dysfunction is the ability for the penis to become rigid and erect and last long enough for satisfactory sexual performance. So how common is erectile dysfunction? Well, it's very common after prostate cancer treatment, but it's actually very common in the community as well. It's been estimated that about 50% of men between the age of 40 and 70 will have erectile dysfunction at some time during their lifetime. So this diagram shows the two main pathways for achieving an erection. So we've got up on the top here we have the male brain, and then down on the bottom here we have the penis, or as the females call it, the other male brain. So essentially there's two main pathways, mental stimuli and then tactile stimuli that can lead to an erection. So for mental stimuli it may be either visual or mental, and a signal comes down the spinal cord here, down to the lower part of the back, and then comes through the pelvic nerves to the penis. Basically, the signals turn on the blood flow, they open up the blood vessels, dilate them, and then blood rushes into the penis. The other pathway is with tactile stimulation. There's a little reflex that goes back to the spinal cord and around to the penis, and again turns on the blood flow so that blood rushes into the penis and an erection performs. Now this diagram here shows you how a number of conditions can affect those pathways. Obviously stress and anxiety here can affect the brain and distract us. Multiple sclerosis and Parkinson's are conditions that affect the nerves. It can affect the signals here. And then in the pelvic nerves, we all know that radical prostatectomy or surgery or radiotherapy can affect the nerves there. And other conditions such as heart conditions, or low blood pressure or diabetes can actually affect either the heart pumping the blood or the size of the blood vessels, so that not enough blood can actually get to the penis. Also testosterone, we've heard from the first talk how lowering the testosterone with hormone therapy can affect the erections. It works in a number of different ways. It does affect the sex drive, like the male menopause, but another way it actually affects the penis so that it doesn't inflate properly. It's a bit like a balloon with a leak in it. It just can't expand. So that's how one of the ways that testosterone can affect the ability to get an erection. So just a little bit more about surgery and how that may cause erection problems. We've talked about the pelvic nerves, and here they are coming down beside it. This is the rectum, the bladder, and then the prostate here. And you can see they come right along the side of the prostate here before they go into the penis. This is a diagram here of the prostate up here and then the rectum here. Now the nerves sit in this little angle here. So if the tumour is confined within the prostate, the surgeon might want to do a nerve sparing procedure, so he comes quite close to the prostate and spares these nerves easily left behind, so the patient can often keep their erections. But if the tumour extends outside the prostate, it's safer to go a little bit wider here and take the nerves, but it means that there's a better chance of curing the tumour. So what about after surgery? Can erections return naturally? And yes, they can. It can take up to 3 or 4 years for the nerves to regenerate and for the erections to return. Generally, it's thought at around about 30 to 50% of men after surgery will keep their erections. With radiotherapy, either external beam or brachytherapy, it's probably slightly higher. Radiotherapy, external beam, probably about 50%. Brachytherapy, probably about 75% of men keep their erections. And obviously with hormone therapy, most people lose their ability to get an erection. But if the patient is on intermittent therapy or the treatment is stopped for some reason, the erections often return, although it may take up to 12 months to do so. So what can men do to improve their erectile function? Well, there are some lifestyle changes. We'll also talk about tablets, vacuum devices, injections, and penile prostheses. So what's the best time to address erectile dysfunction? Well, around the time of treatment, men are naturally preoccupied with thoughts of curing their cancer. It's a very stressful time, and thoughts of treating or dealing with erectile function are actually put to the side. But there is a use it or lose it phenomenon that occurs. The longer you wait before having treatment, the more likely there is some scarring and some damage done to the penis, so it's less likely to work. When men are, you probably remember when we're younger, we wake up in the middle of the night with an erection, and that's a natural phenomenon where fresh blood, well oxygenated blood, flows into the penis to nourish the tissues and waste products are washed out. That fresh oxygenated blood nourishes the tissue, helping it to stay supple and work well. So if men have a long period of time where they don't have erections with that fresh, healthy blood being washed in, well, they get scarring, the tissue becomes inelastic, and men are less likely to get erections. So one of the take-home messages from the talk is that it's a good idea to treat the erectile function or erectile issues earlier on rather than later on. So what about lifestyle changes? We've heard a little bit about stress, and that's really important. There are studies showing that diet and exercise are important too, and it can improve the quality of your erections by about 20%. That's regular exercise. And diet, I mean caloric restriction. In New Zealand and first world countries, people often have too much in the way of food or eat too many calories, but by restricting the food intake to optimal levels, it can actually improve erectile function. Smoking is obviously important because it narrows the blood vessels that deliver blood to the penis, and other measures are important, such as controlling diabetes and some medications. Blood pressure medication, some people come and see me and then we put on a blood pressure medication which lowers the pump pressure essentially, and so not enough blood can get into the penis. And so changing medications may actually improve the quality of erections as well. So tablets are usually the first option talked about by doctors. There are the blue pill Viagra or Aviagra that most people know about. There's two other available in New Zealand, Cialis and Levitra. So how do these tablets work? Well, nerve signals that we've talked about stimulate nitric oxide, which is a chemical in the penis, to increase blood flow into the penis. It's relatively simple and straightforward. And what the tablets do, the tablets keep those nitric oxide levels high. They block the degradation of nitric oxide. So if you've got more nitric oxide, the penis is going to be a bit harder and last a little bit longer than normal. So for these tablets to work, you need to have intact nerves and you need to have some sexual stimulation. They're not really effective in patients who have got severe nerve damage. So the tablets are taken 30 to 60 minutes before you want to have sexual activity, except if those are on a daily dose Cialis. That's a little tablet you take each day, and then they've always got some Cialis in the system. So that's a very effective way of treating erectile dysfunction. It's probably the Rolls-Royce tablet treatment, the daily dose, basically because it brings the spontaneity back into the relationship. You don't have to take a tablet and wait. And so that's why it's very popular. Couple of little points. Aviagra or Viagra is less effective after a fatty meal. It's not absorbed so well, so you don't get sort of peak levels in the bloodstream. Aviagra and Levitra last for about 8 hours, which can have some benefits in certain circumstances. Cialis is marketed because it lasts for 36 hours, so sometimes people can have intercourse that evening and then the next day things are working as well. The studies show that each of the tablets are probably equally effective, but a patient may have side effects with one and not another, so it's best to try all three and then decide which is more effective for you. So after a radical prostatectomy, most men can't get an erection with these tablets. Probably about 10 to 30% do. So what if the tablets are ineffective? Do you need a bigger dose of Viagra? Well, there are limits because you can get side effects. So then you have to look at other options such as vacuum pumps, injectables, and so on. We'll talk about them in just a minute. So how safe are these medications? Well, originally they were developed as a cardiac medication. And when they did the studies, they found that the patients wouldn't give the tablets back. And then they said, well, why is that? And then they found out, well, it was actually good for something else. But there have been studies showing that people who take Viagra or one of these medications actually have a lower morbidity or lower mortality or death rate than people who don't take them. So they are very safe. There are some contraindications that your doctors can tell you about. Side effects, they're generally very well tolerated. Occasionally people get indigestion or facial flushing or back pain and so on, but generally most people tolerate them well. So what if tablets don't work? Well, one other option is a vacuum pump, which is a Perspex cylinder here with a little electric pump in this case, or you can get a hand pump that draws blood into the penis, and then you place one of these little rings over the base to keep the blood in the penis. Here we have a diagram of how it works. So the Perspex cylinder is placed over the penis, flush with the base of the penis here. The vacuum or suction's induced, and then the penis expands in length. Venous or poorly oxygenated blood is drawn into the penis, then a little rubber ring is slipped onto the base to keep the erection firm. So it's best for those people in stable relationships. It's very cost effective. They cost about $600, but they can be used for many years. However, some people find them a little bit fiddly and don't find that they work well for them. And as I mentioned before, with tablets and injections, they draw well oxygenated blood into the penis, so that will nourish the tissues. This is venous blood, the low oxygen content, so it won't help the ability to get erections long term, or natural erections long term. So what about injectables? We've got a couple of options here. These are syringes that may be made up by a urologist, and these are ones that you can buy from the chemist. This one is called Cavaject. So one of the advantages of injectables are that they promote the fresh, highly oxygenated blood to come into the penis, which nourishes the tissues. It's relatively quick. It can produce an erection in 5 to 10 minutes. And as mentioned also earlier, the dose needs to be individualized because some people are very sensitive and will have a lower dose, and people who are not so sensitive need a larger dose. But they're very effective. And so this is a diagram just showing that the small needle is placed into one of the two chambers or cylinders in the penis. It opens up the channels and blood is drawn into the penis quite quickly, and then the natural erection ensues. So it's usually a second choice after tablets because tablets are nicer than using injections, but it's probably one of the most effective options. There are a number of different agents available. Prostaglandin E1 is called Prostin, and that's the same as Cavaject, but you can get different cocktails depending on whether a patient responds to the Cavaject or Prostin. Sometimes other agents are added in. If there's 2 agents, it's called bimix. Trimix is 3 agents, and you can get quadmix as well, which is 4 agents. So as I mentioned, they're very effective, but as with most treatments, there's always some caveats. Some men get some pain, particularly after a radical prostatectomy, so it may not suit them. There is the potential for scarring. In the penis, it's relatively uncommon, but it can occur, and then it's more difficult to get an erection later on. Depending on the type of product that you have, sometimes it needs to be stored in a fridge. And just one final point is just be aware of men's clinics. They advertise, different men's clinics advertise in the paper, but then they don't necessarily have your best interests at heart. Sometimes I get patients coming and seeing me who have been to see them, and they're basically just out to make money, and they want to sell injections. They don't necessarily want to talk about all the options that are available to men. So just be aware of that. It's best to go and see a urologist. So what if nothing works? What if the tablets don't work, if the vacuum pump doesn't suit or is fiddly, and the injections are painful? Well, what other options have you got? Well, the final option is a penile prosthesis. There's a little picture. Essentially, it's a device that's put in within the natural cylinders of the penis that we saw a moment ago when you're looking at injections. There are a number of different options available, and we'll talk about those in a minute. They're easy to use, and they provide an erection quickly within 1 to 2 minutes. So how long have we been using these for? Well, people have been putting in these prostheses for over 30 years. There are around about 25,000 put in a year worldwide, and probably over 300,000 have been placed so far to date. And of all the agents that people use, penile prostheses have the highest partner and patient satisfaction rates. And the reason for that is that it restores the spontaneity in a relationship. They're relatively natural to use, and people can have intercourse whenever they want. So the two main types are malleable rods, a malleable prosthesis here, and then the Rolls-Royce is an inflatable prosthesis, which basically has 3 components. You have a fluid reservoir, which contains salty water or saline that goes in the tummy. You have a little pump that goes in the scrotum, and then you have these cylinders that go in the penis. Now, in the natural state, they're deflated and soft, but when you want an erection, as we'll see in a minute, you activate the pump and fluids transferred into the penis to cause an erection. So looking firstly at the malleable implants, we don't put in too many of these, but they are very easy to use. You can see a picture of the rod here sitting within the penile cylinder here, and then if you want an erection, it's just bent upwards, and then you have an instant erection. They're good for people with limited dexterity. They are totally concealed within the body, and they're the least expensive of the prostheses available. However, sometimes they can be seen through your trousers, and you need to bend them away properly so that people don't think you have an erection. But for most people, it's not an issue. It's just something you have to be aware of. So this is the 3-piece prosthesis, and this is a little animation of how it works. There's fluid in the reservoir here. The patient's activating the pump here, and fluid is transferred from the reservoir through the pump into the cylinder in the penis, and you achieve an erection. Now, when you've finished having intercourse, you just have to touch a little return valve. There's a little button in the scrotum that you push, compress the penis, and then fluid transfers back into the reservoir. So it's quite a simple process. So the advantages of the 3-piece are that it's easy to use, it's a one-step deflation, it provides a very natural flaccidity, it feels like a natural erection. The only thing that's different is that the glans or the head of the penis doesn't expand, and so the head of the penis stays a little bit colder and doesn't swell. But otherwise, it's a very natural erection. Here's a picture, picture of a person before inflating the prosthesis and then afterwards. So you can see that it looks like quite a natural erection. So the advantages are that you can have an erection anytime you choose. You can have an erection for as long as you want. And there are no ongoing costs with tablets or as with tablets or injections. The costs are normally covered by insurance as well. So what's involved in the surgery? Well, essentially it's normally a one-night stay. Patients are a little bit uncomfortable for a couple of weeks or 3 weeks after the surgery, and once they're more comfortable, around 4 weeks, then we can start inflating the prosthesis and using it. Complications are uncommon, but a couple of the issues that can occur are infection or mechanical failure, but they're relatively uncommon. And it's important, because this is an unusual operation to perform, it's a specialised area in urology, that you should go and see someone who has experience in that area. So just looking at the satisfaction rates I mentioned before, that people who are well counselled and choose to have this surgery are generally very happy with the outcome. This is a study carried out in 2000 by an Italian chap, Montorsi, and you can see that both partners and patients are very happy with the quality of the erection. In terms of satisfaction with sexual activity, the satisfaction rates are even higher. Both partners and patients are very happy with the ability to have sexual intercourse and sexual intimacy. So this is a testimony of one of my patients. It just sort of illustrates a couple of things. Firstly, that erections are really important for men. It can make a big difference to their quality of life and to their self-esteem. I'm not sure about this, but now I could kiss him, but anyway. Anyway, this made a big difference for this guy, for this man. His implant is still working. He's very happy. His partner's very happy. And it's nice to see that part of their relationship in their life can continue on. So in summary then, erectile dysfunction is common in men with prostate cancer, but a satisfying sexual life is possible. It's just a matter of addressing the issue. There are a number of options to choose from. We've talked about that, ranging from tablets through vacuum pumps to injections and a penile prosthesis. We've learnt that it's better to start earlier rather than later to preserve erectile function or to give you the opportunity of having a natural erection. So have the discussion, find a solution that suits you and your partner or wife, and choose to see someone with experience. Go and see a urologist with an interest in erectile dysfunction. You'll have the best outcome then. So it depends on what sort of treatment you've had, but certainly there's a few things. Firstly, you don't need an erection to have an orgasm. You can still have an orgasm with erectile dysfunction. The second thing is that sometimes after a radical prostatectomy, having an orgasm can be painful. For most men, it's not an issue, but for some men, a small number, it can be uncomfortable. Sometimes it's just with the first time or two, and we think it may be due to the fact that, with all the scarring and healing that's going on. But for some men, it can be a continual issue, but that's a small number of men.